Good day everyone, this is Heber Ilapisaros, a student nurse from Davao Doctors College. And today, I'm going to perform or demonstrate the complete bed bath. So prior to the procedure, I'm going to perform hand hygiene. This is to prevent the spread of microorganisms. After that, I'm going to assemble all the needed materials in order to save time and energy. So after assembling all the needed materials that we are going to have for our assessment or our procedures, that we have our pail for the used water, and aside from that, we have the bedpan or the urinal gloves. So aside from urinal gloves, we also have our laundry bag and table for our equipment, and we have our personal hygiene, lotion, and our deodorant. So we also need to have our soap, and at the same time our soap dish, and we need to like the basin with sink, the basin or sink with our warm water, then the comb in our for the comb. And so we also need to have our wash clothes, and at the same time our bed towel. So we need 3 bed towels for the sa chest, sa head, and the other one is for the backup towel. Hello sir, good morning. Ako nga pala si Heber Ilapisaros, a student nurse from Davao Doctors College, sir. Can I check your restaurant manager? Okay. Can you please tell me your name, age, and birthday, sir?
I'm Jennifer Rosales, 19 years old. My birthday, April 27, 2001.
Okay, sir. Okay, so now, Sir Jen, I just want you to know that this procedure, some of your body parts will be exposed, but rest assured, Sir Jen, that we will not expose your private parts. So, when I'm going to wet it during this procedure, and I will put some certain products in order for you to feel relaxed, comfortable, and this also in order to remove transient microorganisms in your body. So, and another is to stimulate circulation to the skin and to promote sense of well-being. So aside from that, Sir Jan, is to prevent and eliminate body odor. So okay, is it okay for you, Sir Jan?
Yeah.
Okay. So then I need to assess the we need to assess the patient's tolerance for bathing and activity, and at the same time comfort level, cognitive ability, and musculoskeletal function. And this is to determine whether the patient has a shortness of breath before or during the bath. Assess the condition of the skin. So, Sir John, now is we're going to start your bed bath. Okay? So, but prior to proceed the procedure, we need to offer the client a bed bath or urinal, or ask whether the client wishes to use the toilet or commode. So, the rationale for this is to the warm water activity can stimulate to need to void. The client will be more comfortable after voiding before bath. Cleaning the perineum is advisable. So sir, do you have to use void first, sir, or do you want to go to comfort room, or gusto mo ba mag-CR, sir?
No, I don't.
Okay, sir. Napakalaing question, sir.
No, wala naman.
Okay pa, sir. So after that, we need to arrange our supplies in or over the bed table. So raise the bed in a comfortable working height, lower the rail on your side, and help the patient on a supine position. So aside from that, supine position on the side of the bed. So the rationale for this is this avoids undue reaching and straining and promotes good body mechanics, and it also ensures a client safety. Okay. So, sir, can you do a supine position or lying down so that we can do this procedure properly, sir? So, dito gani, sir, sa mas malapit side of the bed. Okay. So, what we're going to do now is we need to drape a bath blanket over our patient, and I'm going to ask our patient to hold the bath blanket in order for me to remove the top sheet beneath. it. Okay, so the rationale for this is the bath blanket provides comfort, warmth, and privacy. So sir, can you hold this after I put our bed bath?
Yeah, sure.
Okay. Can you please hold our bath blanket, sir, so that I can remove our top sheet beneath it, so sir. Okay. So after removing the bed sheet, so we will put it in the laundry bag. So now what we're going to do is we need to remove our patient's gown. So if our patient has intravenous line, so we need to start or begin our upon removing of the gown to the unaffected areas. So here, okay sir, can I remove your gown, sir?
Yeah, sure.
Okay. So now after removing the patient's gown, so I'm going to down the rails at the other side. So sir, I'm going to down the rails, sir. Okay, here. So after that, we need to press the sensor and pause the fluid infusion in the IV. Pump, take the container at the pole and slip into the tubing through the arm of the gown, then rehang the container and restart the fluid information. If fluids are infusing by gravity, check the flow rate and adjust it if it is necessary. Do not disconnect the IV tubing to remove the gown. Raise the side rails and lower the bed. Fill the wash basin 2/3 full of warm water and have the patient test the temperature of the water. Okay, so what I'm going to do now is I'm going to put water at 45 degree to our basin and I'm going to let the patients check the water temperature. Okay, here. Okay, sir, can you check, sir, our temperature of the water?
Yeah, that's good.
Okay, sir, okay lang po, sir.
Mm.
Okay. So after the patients check our 45 degree water, so I'm going to ask our patient if it is okay for him to put a warm body lotion to our water. Okay, sir, it's okay, sir, if I will put warm body lotion on it?
Yeah, sure.
Okay, sir. Okay, sir, can I remove your pillows now, sir?
Yes.
Okay. So, in removing the patient's pillows, so we need to raise the head of the bed to 45 degrees. Okay, sir, can you turn your heads up, sir? Okay. Sir. Okay, so after turning our patient's heads up, we need to place one towel under the patient's head. Okay, sir. So after putting the first towel to the patient's head, we need to put another towel over our patient's chest, and then this is to protect him his eyes, and after that we need to ask him if he or she is using contact lens. So here. Okay, sir, do you wear contact lenses, sir?
No.
Okay, so let's begin the bath by immersing the wash clothes in the basin and wring it out thoroughly. So, mag-start na ako, sir, sa sa bed bath natin. So, first, kung ililinisan is yung eyes po natin. Okay? So after rinsing it thoroughly, we need to form a myth. So the proper way of forming a myth is we just need to do it like this. Then like that. So we need to form a rectangular shape. So that's the proper way of forming a myth using our wash clothes. Okay. So here po, sir. So in washing our or cleaning our eyes, we need to start from the inner canthus to the outer canthus. And then after that, and after that, we need to wash starting from the forehead to the face, to the ears, and to the neck. So the rationale for that is using separate corners prevents transmitting microorganisms from one eye to the other. So in wiping from the inner to the outer canthus. Okay, sir, do you want me to shave you for today, sir?
No.
Okay, so since the patient is conscious, so there's no need to put a eye drops or ointment for the blinker flicks, so that this is used to keep from him to eyelids closed. So since our patient is conscious, so there's no need to do that. So after that, we need to remove the bath blanket from the patient's arm that is closer to you. So place the bath blanket towel lengthwise beneath the arm with water and minimal soap using long firm strokes. Move it to distal to proximal direction, that is from the fingers to the axilla. Then wash, rinse, and dry the entire arm. So after that, after washing the patient's eyes and all over his face, we are going to proceed now to the patient's arm. In washing the patient's arm, we need to start from distal to proximal direction. So, sir, can I hold your arm, sir? And then we are now going to start our arm from distal to proximal. Other po, sir. So the rationale for that is firm strokes from distal to proximal areas. This is to promote circulation by increasing venous blood return. So after that, we need to wash the fingers and nails need to be soaked. Fold the bath towel in half and lay it to the bedside next to the patient. We need to set the wash basin and immerse the patient's hand. Let them soak for 3 to 5 minutes and then clean beneath the nails and move the basin out of the way and rinse dry the hand towel. Hold your arm, sir, and let me soak your hand 3 to 5 minutes in our basin. In washing the chest and abdomen, we need to cover the patient's chest with a bath towel and fold the bath blanket down to the umbilicus, the bath from the chest again using a long firm strokes. Rinse it off. So for the female patients naman, let's take a special care to the clean skin beneath the breast. Lifting each breast at the back of your hands and rinse and dry the area well. Since my patient is a male, so there's no need for me to lift the patient's breast. So what I'm going to do is I will just clean his chest and up to his abdomen. So the rationale for this is we need to keep the client warm while preventing unnecessary exposure of the chest. So would you mind, sir, if I touch your breast, sir, or chest? Okay. So okay, sir. Now I'm going to clean your. So aside from that, we need to check the temperature and change if it the water, and we need to change it if necessary. So otherwise, continue by washing from to the abdomen. So since we, so now we're going to change the water. So after changing our water in the from the basin, so we need to proceed our cleaning to the patient's abdomen. So again, we need to wet, rinse, and dry our wash cloth. In washing or in using our wash clothes, we need to make a triangular mitt. This is the proper way of using the wash cloth. Okay, sir. Proceed po tayo sa abdomen po natin. If you prefer to finish giving the bath before you help the patient's dress, continue washing to the lower extremities. So we need to cover the patient's chest and the abdomen with the top of the blanket. So now, sir, we're going to proceed to your leg, sir. I'm going to expose one of the leg, and by folding the blanket toward the midline while keeping the perineum covered. So the rationale for this is to covering the perineum promotes privacy and maintains the client's dignity. So here's po, sir. Okay, sir. Here. And we need to use the other bath towel. So proceeding in the lower extremities, we need to arrange the towel lengthwise under the leg, and then now we are going to wash the leg. Firm strokes from the ankle to the knee, and then from knee to the thigh as well. So as we are working, we need to assess for signs, if there are signs of redness or swelling and pain, thoroughly rinse and dry the leg. So the rationale for this is to washing from the distal to proximal areas promotes circulating by stimulating venous blood flows. So repeat the procedure to the leg and then wash the patient's foot, cleaning carefully between the toes. Clean and file the nails as needed according to the feet of the patient in the warm water for 10 minutes. So this will help maintain cleanliness and of the toenails and feet by never soak the feet of the patient with diabetes or any other patient with impaired sensation. So apply a little moisturizing lotion to the feet. So now we're going to proceed to clean the patient's leg. So here, using our wash clothes, we need to start from the ankle here. Here. So, and the foot. Here. Okay. So same procedure in the other leg of our patient. So same procedure, we need to start from the ankle up to the thigh of our patient. Here. And then proceed to the foot. So after removing the towel, we need to raise the side rail, move to the other side of the bed, then lower the rail and follow the same steps to wash the other leg and foot. So we already did that, and discard towels into the linen bag, then cover the patient with a bath blanket. So as what we did earlier, we just, after cleaning our foot and our leg, we just remove the towel and then put the bed blanket. So this is to ensure the safety of our client. Now I'm going to perform how to do the genitals, back and buttocks. Okay, sir. Here's your pillow, sir. And can you, sir, do a side leg position, sir, or lateral position? Okay, sir. Are you comfortable, sir, with this position, sir?
Yeah,
Okay.
I'm good.
So after that, we need to put a towel lengthwise along his side or back. So we are going to put this on his side or back. And then if fecal materials is present, enclose it in fold of underpad or toilet tissue and clean the area with disposable wipes. Keep the patient trim by sliding the bath blanket over his shoulders and thighs, working from the neck to the buttocks. Wash, rinse, and dry his back using long firm strokes. So the rationale for this is to provide warmth and prevents underexposure. So here. So cleanse the buttocks and anus in moving from front to back and paying special attention to folds in the area. So then rinse and dry the area and replace the absorbent pad if necessary. So if the patient's skin is intact, remove your gloves and give a patient a back massage. And then if not, apply body lotion or a moisturizer as needed. When you finish, drape the patient with a bath blanket. So sir, I'm going to help you roll on the back now, okay sir? So but for that, do you want me to do a back massage for you, sir?
No, no.
Okay, sir. So I'm going to roll on your back now, sir, okay? I'm going to put a plain gloves on you, sir. Gown, I mean, here. So, okay. Okay, so after that, we need to comb our patient's hair. And then, okay. So sir, we're finished, sir. So I'm going to put perform hand hygiene. So, and I'm going to perform our documentation for any pertinent observation. So, during the assessment, sir, there's no sign of pertinent observations naman, sir, no? So,
Yeah.
there's no sign of redness or swollen in your, including your private parts. So, all is okay naman po, sir. Okay, sir, thank you for your cooperation, sir, and
Thank you.